Welcome to the Wisconsin Wellness Podcast. I'm Lori Groh, your host, mental health therapist, and practice owner. Each month, we'll showcase a central theme and provide weekly practical hacks, inspiring interviews, and valuable advice from wellness professionals. Our aim is to help you streamline your wellness and mental health journey. So let's start the show. Hi, welcome to the Wisconsin Wellness Podcast. I'm your host, Lori Groh, and today we have two people with us today, which is a little different. I have intern Lizzie Malchow. So Lizzie is interning with me at Shoreside Therapies, and she is a student at Marquette University. I'm very excited to have her also here with us today. And we have Dr. Joseph Rosado. Dr. Rosado is a leading physician as well as a well-respected medical director, educator, published author, and prominent public speaker. His extensive experience in the broad field of integrative medicine, combined with his unique specializations, ensure he can provide a comprehensive level of high-quality care for all members of your family. He has a book out that I'm going to purchase immediately after because it sounds incredible. Hope and Healing, The Case of Cannabis. Welcome, Dr. Joseph Rosado.
Thank you very much. And Marquette University. That university is near and dear to my heart for one main reason. I'm sure you weren't born at this time, but Alfred Butch Lee was a Puerto Rican basketball player that played for Marquette from 1974 through 1978.
Yeah, missed me by just a few years.
I was 12 years old in 74. So from, tween years into adolescence.
Yeah.
A little nostalgia there.
Yes,
There you go.
Okay. So, Dr. Joe, I would love to start out just with a brief summary of how you got into integrative medicine and how did you, go more towards using cannabis in the medical field? Because that's a big topic right now, and a lot of people have questions about it, but I'm curious how you made that journey.
Absolutely. Well, it started at the ripe young age of 16 while I was watching Butch Lee play basketball for Marquette. I knew early on that I wanted to be a physician, and that the story that depicts why I chose to be a physician is in my book. It tells the story of how a child was traumatized and had PTSD and how an individual helped me deal with that and overcome it. And so it's a really great story and an honor to the individual that supported me in that part of my life.
Yeah.
But I knew early on that I wanted to be a physician. And so at 15, when I was a sophomore in high school, they were offering a CNA orderly course. And if you took the course for one semester, you took the final exam, that automatically granted you licensure to be an orderly. And so I did that. And at 16, I became a nurse's aide, working at an assisted living facility. Well, I was the only male working at this assisted living facility. And so you know what my job was, right? Every 2 hours, I was going room to room, shifting and lifting and moving all these residents so that they would not end up with pressure ulcers, also known as the cubitus ulcers. And that's all I pretty much did. And I mean, it was a good job. I was getting paid nicely. At 16 years old, I was making above minimum wage, but that role I was not getting much out of that. I was not getting intellectually stimulated. And so they were hiring orderlies to work at a local hospital as a transportation orderly, where we would transfer patients from their rooms to the X-ray department and vice versa for their procedures when they were admitted. And that was great because when I had downtime, I would go into the rooms where the radiologists were reading X-rays, and I was watching and looking at these X-rays and learning anatomy at the lap of these professionals, these radiologists. And that gave me the kind of like the drive to train and teach because they took time to train and educate me. those 2 years were amazing.
Oh, I bet.
From 16, 18, it was a wealth of knowledge. And so I went on to pursue medicine. I went to Mexico, to do what's called prepa, which is 1 year of undergrad and then 4 years of medical school. And the medical school was linked with a medical school in the United States, where once I graduated in Mexico, I would go to California, do what's called the fifth pathway, take my boards, and boom, I was in. Except Mexico didn't like me as much as I like Mexico. I ended up with salmonella, shigella, amoebic dysentery, typhoid fever, bilateral kidney, infection.
What?
I mean, I was there exactly 30 days. And of those 30 days, I was in the hospital, total of 7, on and off. But
oh my God,
25% of my time there, I was in the hospital. And there was this one lady that had become friends with my parents. And so she went to the doctors and said, look, let me go ahead and take care. As soon as he gets discharged, let me go ahead and assume care for this young man. I'll take care of him. And the head of the hospital said, no, you're not going to do that. We're waiting for his fever to break because I had a temperature of 40 Celsius, which is 105 here. Once his fever breaks to 39, we're putting his skinny ass on an airplane and flying him back to the U.S. so he can die there. We don't want him to be a statistic here.
Oh my gosh.
Oh my God.
So, yeah. So, needless to say, I left. It took about a year for me to recover from all of that went on in my body. And so, one of my good friends' girlfriend was a nurse in the emergency department at the same hospital I had worked as an orderly. And she, one time having dinner, she's like, why don't you guys consider the EMT program, getting your EMT certificate? And we're like, hey, that's a good idea.
Wow.
And so I went to EMT school, then took the boards, passed, then went on, became a paramedic. So I was an EMT, then a paramedic. I worked on an ambulance for about 5-6 years, got burnt out because you do burn out.
I would imagine.
And it was right around towards the latter part, we're talking about mid-'80s now. And so it was right around the time where crack cocaine was huge. And we had, when it first happened, we had no idea. We had no protocols. We had no standards of care on how to treat these crack cocaine overdoses. And it was just too much. And so at the time, the same hospital where I worked while in high school was starting a pilot program where they were taking paramedics, respiratory therapists, and critical care nurses and training us to be cath lab technicians, to work in a heart cath lab.
Mm-hmm.
And so I transitioned over, participated in the training, was trained, and worked for about 1.5 years, 2 years. And again, was in love with the whole concept. I was pre-med, heading to medical school, was involved in a severe automobile accident where I suffered a compression fracture in my thoracic spine, in my low mid-back area. And I was, I had numbness and tingling from the waist down. And for the first 24 hours, I had some paralysis. I didn't have any feeling, sensation. I wasn't moving very well, spinal shock. But then when that wore off, I had some numbness and tingling. And I got the standard, well, we've done as much as we can. You're going to have to give it time. And I'm like, no, I'm in my 20s. I was in really good shape physically. I'm like, no, this isn't going to happen. So I went to a chiropractor who I had seen for a sports-related injury years before, went back to him, super sweetheart of a gentleman, started working on me. And within 2 weeks, all the numbness and tingling was gone. My flexibility was coming back. My strength was starting to come back. And so I was so impressed with what he did that I opted not to go to medical school and went to chiropractic school. So I wanted to go back and give to the community. I also did not like the winters. And so I moved to Arizona, lived there, practiced there for 3 years. My twin daughters were born there, but I got frustrated with the limited scope of practice.
Ah.
And one specific incident was with a little girl. Her name is Annie, and she made a big difference in my life. This little girl, her parents and she were involved in an automobile accident. So I was treating them for their auto accident injuries. And in the history, it turned out that the little girl had a goiter. Her thyroid was enlarged. And so she would have these issues where she would get crazy fevers. And then when her fevers would go up, she'd end up with febrile seizures and would go into full-blown seizures.
Wow.
And so I'm hearing the dad, and he's like, "Oh, doctor, this is Ruben." I'm like, "Oh, hey, Ruben, how are you? What's going on? Why are you calling me on a Sunday morning?" He's like, "Oh, it's Annie. She's got a really high fever. We're afraid that she's going to end up having a seizure again." And I said, "Why don't you just go to the emergency room?" He's like, "No, because we're illegals. And if we're illegal and we go to the hospital, we can get deported." This is 1995.
Yeah.
And I'm like, holy crap. I'm like, okay. So look, I'm talking to you now as your friend, as a former paramedic, not as your chiropractor. Can we establish that? Like this major disclaimer, give me your address. I'll go over and I'll check on her and see what happens, because if she does have a seizure, we need to know how to manage it. But the minute, if she seizes between now and the time I get there, just dial 911. And he's like, okay.
Yeah.
So I get to their house, and as I turn onto their street, I see the EMS pulling away with the lights and sirens. And I'm like, crap, she seized. And I'm standing at the foot of the stretcher, and this little girl is in what's called status epilepticus, like nonstop seizing. And they're trying to start IVs. They can't. So they do what's called an intraosseous line, where they put a catheter straight into a long bone, the tibia in her leg, and they're giving her fluids that way. They're giving her medications. She's not responding to anything. She's urinating on herself. She's defecating on herself. Foam is coming out. I mean, she's a tiny, tiny little girl. And I'm just massively in shock, because I'd never seen anything like this. All the years on the street, I'd never seen a child go through this type. I've seen seizures, but nothing to this extent.
Yeah.
And so once she finally was able to, they calmed her down and they controlled the seizure, she stopped seizing. I'm like, okay, well, my duty here is done. I go to the car and I felt so inept.
Yeah.
It's like, I couldn't do anything for this little girl.
Yeah.
And I said, I will never be in a position where I cannot do something for a patient of mine.
Yeah. Yeah.
And so the next day, I went to the Yellow Pages, because again, there was no internet. And I find, Princeton Review, Kaplan Review, and I start calling them for test prep to take my MCATs, because I decided I'm going to medical school. And so combining all of those years from 16 on into my early 40s, late 30s, early 40s, was what really formed me as a provider. While in medical school, I am a unicorn. Less than 10% of medical schools in the United States, and I would venture to say the world, teach about the endocannabinoid system. The fact that we produce cannabis. That's a concept that's foreign to 90% of physicians and, 99% of the world.
Yeah, I did not know that.
Yeah.
I did not know that.
We hear about the respiratory system. We hear about the cardiac system. We hear about the, nervous system, but nothing about the endocannabinoid system that is involved with every one of the major organ systems, because there are cannabinoid receptors at every one of those organ systems. And so we learned about that, but then immediately it switched from, yes, we have cannabinoid receptors, and yes, we do produce cannabis. However, it's a gateway drug, it's toxic, and it leads to shooting up. I'm like,
yeah,
really? And so that night I went, to my house, and I pulled up my pharmacology textbook, which is like the pharmacology Bible, and I looked up cannabis sativa. And I learned about it and read about it and discovered that it does not cause physiological dependence. It causes psychological dependence.
Yeah.
But not physiological. It's not like alcohol. It's not like an opiate or a benzodiazepine or cocaine or anything like that, where you stop and you crave the drug. That's not the same with cannabis. Cannabis, you just have this psychological dependence that if I don't use it, I cannot function type of
Right.
thing. But it's not that your body yearns to have it in its system. But again, it was another tool in my toolbox. I put it off to the side because I was in a country that was illegal. It became legal in the United States in 1996 in California. Not a whole lot of states had medical cannabis programs at that time. And so it was just something that I put in the Rolodex in my mind. Lizzie, Rolodex is a little box, had your names and phone numbers on.
I've seen one before, I promise. I
Yeah.
swear. I promise.
Help is just a click away with Shoreside Therapy's free 15-minute consultation. At Shoreside Therapies, they offer personalized therapy services that combine evidence-based techniques with genuine care and understanding. They provide various solutions to make the therapy process more accessible, including virtual appointments and assistance with insurance benefits. Their team of licensed therapists is dedicated to helping you build resilience and confidence while navigating life's challenges. Join Shoreside Therapies on your journey to finding inner peace and happiness. Go to shoresidetherapies.com for a free 15-minute consultation and discover the benefits of counseling. At Shoreside Therapies, again, shoresidetherapies.com, and schedule your free consultation right online. So, Dr. Joe, I'm really curious. In particular, when I was reading about you, what stood out was the use of cannabis for Alzheimer's. Could you talk a little bit about that? I'm curious on how that would work and what are some of those benefits?
Well, Alzheimer's is a condition that's near and dear to my heart. On my father's side, every one of his aunts and cousins, female aunts and cousins, all contracted the condition and died as a result of it. On my mother's side, and the first person that I was exposed to at the age of 19 was my grandfather, my mom's dad. He had Alzheimer's. And so it's a condition that I've seen pretty much growing up among my family. And a few months ago, rather, I went ahead and did the genetic marker test for Alzheimer's. The APO capital letter E, the number 34. So ApoE34. I tested myself and I came back positive with both alleles. So I have 100% probability of having late onset Alzheimer's. So knowing that, now I am working diligently to do what I can to prolong that as much as possible. So this is near and dear to me. And so I began to research this years ago. Every year I go to Colombia to lecture on medical cannabis at the Canna World Congress. And there's a town just outside of Medellin where I normally go to speak called Yarumal, which has the highest incidence of Alzheimer's. And so they wanted to do a program to study these people and incorporate using cannabis to support them because different phytocannabinoids, phyto meaning plant, cannabinoids meaning that work on the cannabinoid receptors, they cross the blood-brain barrier and have excellent functionality in decreasing inflammation. But studies have also shown that aside from stopping inflammatory processes, for example, THC is 20 times more powerful than aspirin as an anti-inflammatory and twice as powerful as hydrocortisone as an anti-inflammatory. CBD is an amazing antioxidant. CBG is 5 times more powerful than CBD as an antioxidant, anti-inflammatory. And then there are other substances called terpenes, which is what give the plant the smell and taste. So this whole combination or an entourage effect is going on as it crosses the blood-brain barrier and it blocks the further progression of the formation of these plaques that lead, the amyloid plaques and the tau proteins. And so learning and researching all of this, and they've created medicines that they've done clinical trials in the Commonwealth of Puerto Rico, which we have a very high incidence of Alzheimer's among our ancestors because the Taino Indians, which are the Native Americans that were found in the Caribbean and certain countries in South and Central America, have a genetic predisposition for Alzheimer's. And so that further threw me into this area. And so using cannabis, it was interesting. The first Alzheimer's patient that I treated with cannabis, he came into the office, would go in and out, was not real responsive or anything. He was already being fed with a feeding tube, but we treated the gentleman with oils, just, pouring, putting oils in his food. And he came back 2 weeks later. And when he came in 2 weeks later, he looked at me. He's like, "You're Dr. Rosado." And I was like, "You remember me?" And then the family started crying and they started telling me how every day he was like more with the program, more alert. And then I discovered about this medicine in Puerto Rico called Hyalalex, which is a combination of cannabis, turmeric, and melatonin. The melatonin, because people that have Alzheimer's suffer with what's called sundowning, where they sleep during the day and they're up all night because they lose track of when's day and when is night. And so the melatonin helps with the sleep. The turmeric, an anti-inflammatory agent, in conjunction with the cannabis that also has anti-inflammatory, antioxidant properties, that combination, they started doing clinical trials, first on animals, and they had rats that had the same gene that I have, and were showing how they were able to progress with the maze testing that they were doing. And so then they started using it on humans.
So it's interesting, right? Because when most people hear about cannabis, they would think memory loss or not paying attention, not being alert. I'm curious too, if somebody was diagnosed with Alzheimer's or dementia, how would they go about that next step? Do they reach out to you? How do they talk to their doctor about it first? What typically happens at that point?
It depends what state they're in. So if they are in Wisconsin, they're pretty much SOL because you guys have no laws. So they would have to go to a neighboring state like Minnesota or Illinois or Michigan to be able to obtain cannabis and go to a medical cannabis doctor. So really the first step is finding a medical cannabis doctor in your geographic region. If you're in a legal medical state, then great. If you are not, then go to a neighboring state. And unfortunately, by going into a neighboring state, for example, the laws in Florida, for you to obtain a medical marijuana card in the state of Florida, you either have to be a resident, a permanent resident, or a seasonal resident, because we have snowbirds. And then from there, getting products that are going to be beneficial to their specific condition. In this case, with Alzheimer's, making sure that it's rich in these specific phytocannabinoids that are going to be able to block the progression of the disease, the condition, but also restore balance. As we mentioned earlier, there is an endocannabinoid system. We do produce cannabis. As we age or as we experience dis-ease, lack of ease, our levels drop. And so we have to utilize cannabis from the outside exogenously to support our endocannabinoid system to bring us to what's called balance or homeostasis in medicine. And so by having that balance, that homeostasis, then it allows for us to function properly.
Yeah. And most important thing, Dr. Joe, is that people don't just go to a dispensary and just pick it up and just start gobbling down.
That's a big challenge.
The gummies,
because, for example, in your case, not you specifically, but people in Wisconsin that do not have a medical cannabis law. and you go to a neighboring state, you are ineligible to get a medical cannabis card because you're not a resident of that
Yeah.
state. And so you have to resort to an adult use, aka recreational market. But when you go into an adult use dispensary, all that bud tender is going to tell you is, well, this is what I use. Unless they have a personal story like I do with Alzheimer's, aside from the fact that I am a physician, but if I were a bud tender, I would say, okay, my family has Alzheimer's. Their doctor gave them this and this worked. They may not know. They know what's going to help them with sleep. They may know what's going to help with anxiety. They may know what's going to help with depression, maybe some post-traumatic stress disorder. But anything above and beyond that, it takes a little bit more knowledge. And so for that reason, I wrote the books. I've done the lectures. I've, dedicated the greater part of my life from 2014, really, because I was advocating for cannabis in Florida before we had any laws. I started advocating in 2014. We didn't have any products or laws in the books until August of 2016, which my first patient was a 35-year-old female that had a stage 3 brain tumor. And then 3 months later, in November of 2016, my first pediatric patient had a stage 4 head and neck tumor. And so I was the first in the state of Florida to recommend cannabis to a child and the first in the greater Central Florida area to recommend to an adult.
Wow. That's incredible, though, to have had all of that background knowledge, to be immersed in the medical field and move through it and see, okay, there are limitations to what's available as far as medicine, and that there's other opportunities to use what we already have in our system to help and heal. Dr. Joe, I know you're coming to our neck of the woods soon. So do you want to share before we end how people can reach you? And is that event that you're doing, is that open to the public?
Yes, it is.
That is open to the public. Okay. Could you share that?
Absolutely. Yes. I will be on an airplane traveling to Appleton, Wisconsin. And then I'll be driving to Crandon for the Indigenous Cannabis Industry Association Summit, where on the 27th, I will be the keynote speaker. And on the 27th, it is open to the public. So go to ICIA, or the Indigenous Cannabis Industry Association website, or their social media pages. They are on LinkedIn, Facebook, ICIA, or Indigenous Cannabis Industry Association. I'll be the keynote speaker on the 27th, and the topic is going to be pretty amazing. So I would love to see the two of you there.
Oh, yeah, I would love that.
It's going to be a phenomenal presentation, if I do say so myself.
Oh, well, thank you so much, Dr. Joe. This was really great.
And then to find me, go to my website, josephrosadomd.com, josephrosadomd.com. So I'll either see you in Wisconsin, or you can reach out to me on my website. You can shoot me an email. There's an 866 number. You can call me and it'll go to one of my assistants, and we'll get you set up and scheduled to see or speak with me.
Awesome. Thank you so much.
Thank you.
Thank you for joining us today on the Wisconsin Wellness Podcast. Remember, your well-being is a priority, and we're here to help support you every step of the way. If you've enjoyed today's episode, don't forget to rate, review, and subscribe to our podcast for more inspiring content on health and wellness. You can also join our Facebook group to connect with Wisconsin wellness providers by clicking the link in our show notes. Take care of yourself, and remember that your well-being is a journey, not a destination. We look forward to you joining us again next time on the Wisconsin Wellness Podcast. Until then, stay well and stay inspired.